I bet you didn't know that there is a hidden crisis going on in autism. Yes, there is a hidden crisis in autism. And today we're going to talk about the alarming truth about autism's future. And this is going to be a long one today, so I apologize in advance, but this is something we need to talk about. Okay? For families and for people who know someone who has autism. All right? So, first, we're going to start talking about some autism statistics. And I got these statistics from the CDC and from Autism Parenting Magazine. And these are recent statistics. So boys are 4 times more likely to be diagnosed than girls. This we know. Although autism can be diagnosed before a child reaches the age of 2, most kids are diagnosed only after the age of 4, which was the case in my son's diagnoses. 40% of children diagnosed with autism are nonverbal. 40%. Yeah. And some areas like regional areas, have higher than average prevalence rates. Like in California, like in right now in our country, 1 in 36 kids are diagnosed with autism, where like 20 years ago it was like 1 in 10,000. But in California, it's 1 in 26. So depending on the region, it matters. Yeah. About 1 in 6 children aged 3 to 17 years were diagnosed with a developmental disability, as reported by parents during a study. And this was from 2009 to 2017. And this includes autism, attention deficit, hyperactivity disorder, blindness, and cerebral palsy, among others. And apparently, this group of children, these diagnoses may be undiagnosed by physicians or not, but this is reported by parents. So, these parents are seeing these traits in their children as well. This is a crisis, okay? Let's talk about this hidden crisis. And I'm saying hidden, like we know that autism rates are going up, but let's take a deep dive into what's really going on, right? Because this is important. Because it's affecting all of us. As much as people want to say, oh, well, thank God my kids don't have autism. It's affecting all of us, okay? When you're at the restaurant or you're on the airplane and there's a kid on the spectrum that's screaming their face off, it's affecting you. It's affecting all of us, okay? Whenever your kid is at school and, your child is in a general education classroom and the teacher has to stop teaching so that they can, put their time and energy and efforts into the child with special needs because they don't have the help and the assistance and the programming and the aid that they need, it's affecting your child and your child's learning too. It affects all of us. So let's talk about it. Why? Why is there a crisis? Let's talk about some of these alarming truths about autism in the future. Crisis number 1. Autism is increasing. Why? The first reason, I believe, we have improved diagnostic methods and awareness. Okay? So I think that 20, 30, 50 years ago, we didn't have the awareness that we had then, or now, right? I think that then whenever there were kids or even adults who were on the spectrum, they didn't identify it as autism. Or if it was autism, autism looked like one thing. And so, if there was another individual who had autism and it didn't look like what they thought autism looked like, they called it something else. So, I don't know if you remember back in the 70s and the 80s, they had children who they categorized as mentally retarded. They weren't mentally retarded. Some of these kids had autism, but they didn't identify them as children with autism. Does that make sense? So they didn't fall into that category, or at least they didn't label them as children with autism. Do you see what I'm saying? So they were on the spectrum, but they didn't realize they were on the spectrum, because if you see my t-shirt, they only saw the spectrum as being one way. They saw it as being linear, when that's really not what the spectrum looks like. Does that make sense? Greater public awareness about autism, including among parents and healthcare professionals, leads to an earlier identification and diagnosis. Okay. And over time, the diagnostic criteria for autism spectrum disorder has expanded, allowing for the identification of individuals who may have previously been missed. Okay. So even there were times where a child may have had some behavioral issues, and they're just like, well, they just have behavioral issues. They just have bad parents. They just have issues. We're going to classify this child as a criminal. No, they have a learning disability. They have dyslexic. They have what, you know what I mean? Or they have autism. They might be highly intelligent. They might be able to get through the academic. They might be, they may test really well. They may be able to handle the generalized academics in the school system, but they could still have autism. But instead, they categorize them as something else. Yeah, that's all I have to say about that. Next, the potential increase in actual prevalence. So maybe autism actually is going on. Maybe it's not just that more kids are being diagnosed because now we know what it is. You know what I mean? But maybe back then there were more kids that had autism. They just didn't label it correctly. But maybe now that we really understand it more, maybe it is actually going up. Autism has a strong genetic component, with studies suggesting that certain genes or genetic variations may increase the risk. But there are also environmental factors. Research suggests that environmental factors such as prenatal exposure to certain substances or complications during pregnancy, but also chemical exposure, that plays a part as well. It's increasing. More people are exposed. Other factors to consider: misdiagnosis. In the past, some individuals who now receive an autism diagnosis may have been misdiagnosed, which we just talked about. But there are socioeconomic factors. Status and ethnicity may play a role in autism prevalence, with some studies indicating that children from lower socioeconomic backgrounds may have higher rates of autism. And that has to do with a lot of things. That's a whole nother life. The next crisis I want to talk about is that many families, and this is what I'm noticing, are being denied an autism assessment. Denied. So what's happening is parents are watching their child. We have more awareness of autism now, right? So parents understand what traits and behaviors to look for in their young children, right? So at their next doctor's visit, they go to the doctor and the doctor says, well, how's little Bobby doing? Do you have any questions? And the parent says, these are some things that concern me about my child. And then the doctor says, I wouldn't worry about it. Give him some time. That's what happened to me. I told you that. You know that story. all the way until he was 5 years old. And I told the doctor that I wanted him to be evaluated, and she said no. Why is this happening? And this was 20 years ago. Why is this happening? Let's talk about it. Number one, they don't look autistic. Many professionals still operate with an outdated or narrow view of what autism should look like. We're not talking about people out in the street. We're not talking about your family members. We're talking about medical professionals who are not trained. We're talking about your general practitioner, your primary care physician. Many doctors only expect severe symptoms like nonverbal behavior or obvious meltdowns. Children who are verbal, who do well academically, or mask their symptoms, especially girls, are often overlooked and dismissed. I was having a conversation with my husband a couple weeks ago about my son's grade schooling experiences. And I mentioned to him that here in college, this is really the first time he's really gone to school with girls. And it's not because he went to an all-boys school. My other son went to an all-boys school because it was all boys. But Hassan didn't go to an all-boys school, but because he was in special needs classes for children with autism, it was usually all boys. Boys are diagnosed most times, with autism than girls. So what is happening is that typically girls are overlooked. Another reason, there are long waiting lists and limited providers. So what will happen is, parent will get to the doctor's office and the doctor might say, yeah, let's have him tested. I mean, it can't hurt. Let's go ahead and have him tested. They'll write them the prescription. They'll give them the referral. They'll hand it to the parent, and the parent will go ahead and call for the referral. And it will take months. And when I say months, I'm talking about like almost a year. And parents are like, what am I supposed to do in the There are parents right now in these autism groups on Facebook that I'm in. They're in the autism groups because they know their child has autism, but their child is not diagnosed yet because they're waiting for a diagnosis. They're like, yeah, we're waiting for our to be seen. We're waiting for our assessment. We've been waiting. We're waiting for a phone call. Our appointment is next year. The next reason, insurance denials or high costs. There are some parents who go to their practitioner, get the referral, make the appointment for the assessment, and will get to the assessment and find out their insurance won't pay for it. Call the insurance paper or get a letter in the mail from the insurance provider, and the insurance provider will say, there's not enough evidence to support the fact that your son or daughter may have autism because, and they will list the reason. They're like, they seem to play nice with others because in some cases, the insurance provider will want some information from, the school or the, what I mean? The provider, the referral from the doctor has to explain why the child needs a referral because time out. A lot of these parents are scared because so many children are on the spectrum. And so they're watching their child like a hawk under a magnifying glass. That could be autism. That, oh, look at what they did. My child might have autism, right? So every other parent is like, test my kid, test my kid, test my kid. And so the insurance companies are like, we know that those tests cost so many, you know what I mean? Like hundreds of dollars. We don't want to pay for these tests, right? So they're denying them. And so a lot of times parents have to pay out of pocket for these tests. And a lot of these costs, a lot of these tests can cost thousands of dollars. Yeah. Or the parents may have a hefty out of pocket, like a deductible or what. Yeah. The next reason, the schools will say they're fine. Remember, I told you that happened to me. I had a 5-page document from a child development specialist. Took it to the district and said he has special needs. He needs special ed class. And they evaluated him for a half hour and said he's fine. We can mainstream him. He'll just be fine because he didn't seem autistic enough. In schools, staff may dismiss concerns by saying the child is just a little behind and will grow out of it or doesn't need services. Because schools assess for educational impact, not medical diagnosis. It costs the schools too much money to put appropriate personnel for the least restrictive environment in place for your child that has autism. That's why. The next reason, masking and misdiagnosis. Let me tell you what masking is. Let me tell you a story. I noticed a long time ago, Hassan will do this thing where this is what I noticed about Hassan. Hassan is Hassan. He does his thing. He's who he is. I told you in another video that he does this thing, what my husband calls prancing, where he does this quirky awkwardness where he's walking back and forth and he's doing his silliness, okay? He talks to himself, he hums, you know what I mean? He does his thing, he does his Hassan thing, okay? But if my other son is here, Hassan's brother is here, and he's over with some friends, Hassan will shut all that down because he wants to be like one of the cool kids. You know when else he does that? When he's on Georgia State's campus. It's called masking. It's when autistic kids are aware of their behaviors and they suppress it to try to fit in. When I witnessed it some years ago, I thought, oh, well, he is kind of blending in to level up his behavior so he can, it's masking. So what'll happen is you'll take your kid to the doctor to be evaluated and they'll start masking. And they won't act the same way at home or at the doctor's office as they do at home. And so they'll act all mature and polite and reserved. And the doctor will see them for an hour and be like, oh, well, he's fine. And you're like, he's not. He's not. This is not how he acts. I talked about this like a week or so ago. I'm like, I'm trying to tell you, I'm with this child 24 hours a day, 7 days a week. I'm telling you how he is. The doctor spends a half hour, 45 minutes with him, and your child's all like with a halo. Remember the cartoons? They have a halo over their head, and they're like this. Masking. Some kids, especially girls and high functioning boys, learn how to mask their symptoms and blend in. They may be misdiagnosed with ADHD, anxiety, or behavioral disorders, which delays proper identification. Their real needs often go unseen until burnout or crisis hits. It's not good for the child because they got the wrong diagnosis and so they don't get the correct treatment. Yeah, that's real. The next thing, cultural and language barriers. Families from diverse backgrounds may face added challenges due to lack of culturally competent evaluators. Family comes in, they have an accent, there's a cultural, barrier, and they don't understand. You might have, a family where English is not their first language, and there is a cultural barrier, right? And so the doctor, that's an issue for them, and they can't properly evaluate the child. Language barriers, fear of stigma on the family's, from the family's perspective, where and my experience with this, with my own family, but also with other families, is usually it's the dad who's really upset, just like, not my son, that kind of thing, and they are trying to hide the fact that there's something quote unquote wrong with their child. We don't need your help. We don't need, you know what I mean? But professionals overlook symptoms because of cultural misunderstandings or biases, which is, another reason why parents are not getting the help that they need. But there's a lot of gatekeeping by professionals as well. Some pediatricians, therapists, or educators may tell parents to just wait and see, or they might just minimize the symptoms. That's what happened to us. Oh, well, boys are lazy. Yeah, he'll grow out of this. Let me tell you a story. Wait. I'm sorry. This is a side note. This has nothing to do with Hassan. This is about my other son, okay, who doesn't have autism, okay? He jibber jabbered until he was 3. He didn't. Actually, my family and my ex-husband's family thought something was wrong with him, not Hassan. Okay, true story. He jibber jabbered until he was 3. He didn't talk. He was almost 3, and he didn't say anything. Right? Everybody was like, "You need to get him evaluated." So it was like, everybody was like, no. So I'm saying that to say that I get that boys are lazy. The whole potty training thing. Girls are quicker than boys to learn things. I get that. And that theory would have worked for Hassan, except he did everything early. This child was walking at 10 months. He did everything early until he didn't. And I know why, and that's a different video. We'll talk about that another time. But yeah, that whole wait and see thing, I did wait and see. He's 5. And now we need to do something about it. I've waited 5 years. Now let's stop telling me to wait. Like, how long am I supposed to wait? You're gatekeeping. Stop it. Stop minimizing his symptoms, okay? They'll minimize the symptoms, especially if they are unfamiliar with the full spectrum of autism. Again, medical professionals who don't know any better. Instead of saying, you know what, that's not my scope of work, let's get you to someone who knows better. There are so many doctors who are like, oh, I know, but I'm a doctor, so I'll just tell you. No, what? You don't know anything. You know what I mean? This often delays diagnoses during the critical early years. This hurts the child, and it's detrimental for the parents, period. Okay? So the third crisis, the future of autism. What does the future of autism look like? What will parents face if the system doesn't change? Let's go. An increased burden on families. Without access to appropriate school programs, therapy, or adult services, parents will continue to carry the full weight of responsibility, often juggling roles as teacher, therapist, advocate, and caregiver, while managing jobs and households. We talked about this. Something's got to change. Mm-mm. What else? Delayed or denied diagnoses. If evaluation wait lists grow longer and professionals remain scarce, many children won't be diagnosed early enough to benefit from early intervention. That missed window can mean harder battles down the road, emotionally, developmentally, and behaviorally. And that's sad because as autism rates are going up, more and more children will be delayed that diagnosis, and that means there'll be delayed access to care. And that's not going to help them or the families. Okay. School systems in crisis, and we already know where that's going. A lack of trained special education staff and proper accommodations could make inclusion feel impossible. IEP meetings will become more combative, burnout among educators will rise, and more families will be forced to pull their kids from public schools without a viable alternative. It's that's a whole mess. Because it's like, and what's happening right now, and what I keep seeing in this space is that it's like this spiral downward, right? Parents are putting their child in the public school system because the schools are not allowed to deny them. Okay? So they're putting them in, and then they're putting them in regular classrooms with regular teachers who are not trained. So the child's not getting what they need, but then the teachers, can't handle them because they're not able to give them the attention that they need. Then the teachers are complaining to the parents because their special needs child can't sit still, and they don't have the support that they need in the classroom. So then the parents are complaining to the principal that they're disrupting the classroom. And so then eventually the child is getting suspended. It's this terrible. It's terrible. And then based on what's going on in the school system anyway, the supports are going away, the programs are going away, the teachers are going away because they're not getting paid and they're not getting their support and they don't get the funding, and it's bad. Next, mental health decline in parents and kids. As supports decrease, the emotional toll increases. Supports are decreasing, but emotional toll increases. Parents may feel chronic stress, anxiety, and depression, while autistic children and teens who aren't receiving appropriate support may feel misunderstood, isolated, or even unsafe. I don't think I have to explain that. It's not okay. Employment and housing gaps for autistic adults. So for families who have autistic children, those children are going to become adults. So you got to think future for them. Without functional transition programs or life skills education, more young adults with autism will age out of the system unprepared and unsupported. This means fewer employment opportunities, lack of independent housing, and long-term dependence on already strained families. My goal for my son is to put him in a position where he can be independent and live without us with support. That's my only goal. I'm not trying to cure his autism. I'm not trying to change all his behaviors. I'm trying to put him in a position where he can live away from us because he wants to, but put a system in place where he can have the support he needs, where I don't have to worry about him, so that he could live the life that he wants to live. That's all. That's what every family wants for their child, at the very least. Because if something happens to me, and something happens to my husband, and something happens to Hassan's dad, he has to be able to function. And I want him to have the life that he wants. I watched the video the other day of autistic young adults who aged out of the system, who were in a place where their families just couldn't take care of them anymore. It was almost like a memory care facility for elderly people, except it was for like adults with autism. And they just lived there. It was like a state program thing, and it was heartbreaking because I would never want to put my son there, ever. It was like a state facility. It wasn't the cleanest place. It wasn't the most. It was overcrowded, and you had some minimum wage state workers in there, doing what. I don't want my son to live there. I want my son. My son has hopes and dreams. He has preferences and likes and dislikes. I want him to live the life that he wants. Just like I want to live just like you want to live the life that you. Okay? Last, there's going to be a widening inequality. Families with financial resources may still be able to access private therapies or specialized schools, while others are left behind. What are we talking about? We're talking about the future of autism, right? And what parents will have to face if nothing changes. If things are going the way they are, this is what will happen. A widening inequality, right? The gap between those who can afford support and those who can't will grow. Isn't that what's already happening? Just in general. Without us talking about people with disability, just in general. The rich are getting richer, and they can afford all the things, and the poor are getting poorer. That's just what's happening. Don't you wish there was a way to be able to get your child in a place that they could thrive without all this crazy? Well, that's why I put together a 5-part series talking about the root of autism. Because it's not just about the applied behavior analysis, the ABA therapy that they're doing. The ABA therapy is all about behavior. But in this 5-part series, I'm going to talk about what's behind the behavior, what's going on in the brain. Okay? I have been doing this with my son since he was little, and it's been working for him. What I know for sure is that my son will be able to live in his own apartment one day. He may have a roommate. He may have, a cleaning lady to come. Please, I want a cleaning lady. But he might have a cleaning lady that comes once a week. He might have somebody that come, you know what I'm saying? He's going to have supports. But what I know for sure is that he will be able to live away from us one day. What I know for sure. And it's because of what I put into this 5-part series. And I'm going to teach it to you for free. And my 5-part series starts on Monday, April 14th. All right? So I want you to stay tuned. I want you to tell somebody about it because, listen, my goal is to get parents what they need for their children. Because this right here that I just talked about today is real. Okay? and nobody's doing anything about it. I am. Okay? So, thanks for watching. I'll see you in the next video.